Hello and welcome to this hybrid, meaning on-site and online session, Pandemic Preparedness and Response. You might be wondering what La Brüninghaus is doing on this stage. I'm actually only a moderator assistant, kind of helping out here because Nadine Duisberger, who is hopefully online already, do I see you? Yes, I do. She will be moderating this panel, and she's too sick to travel, but brave enough to be here. I believe you're on your webcam in Frankfurt, and I'll be your assistant here, so I'll do whatever you tell me to do. And the first assignment, I believe, is calling your guests who are here in Berlin with us on stage. So please welcome with me, first of all, Mrs. Anja Langenbucher, Director Europe of the Bill and Melinda Gates Foundation. Please sit here in the middle, if you will. Then we're happy with us is Dirk Meyer, General Director of Global Health in the Federal Ministry for Economic Cooperation and Development. Welcome. Please sit here. And also with us in Berlin is Lars-Hendrik Röller. If you've been with us throughout these last 2 days, you've seen a lot of him already, but there's much more to say. Former G7 and G20 Sherpa and Professor for Economics here at the SMT in Berlin. Welcome. And we are very happy that two more of you are taking the time to dial in from abroad or outside Berlin. First of all, I want to welcome Vera Songwe from the United Nations, Under Secretary General, and UNICA, Executive Secretary, oh God, I wouldn't have wanted to mess that up, Executive Secretary of the Economic Commission for Africa, UNICA. Welcome, Vera. And last but not least, also digitally with us is Michael Kramer, Nobel Laureate and Professor of Economics at the University of Chicago. And now I'm going to stop messing up names and titles, and over to you, Nadine.
Thank you so much, and welcome to our panel. The Global Health Security Index 2021 reveals that although many countries were able to quickly develop capacities to address COVID-19, all countries remain dangerously unprepared for meeting future epidemic and pandemic threats. According to the numbers, average scores in prevention, response, and risk environment decreased since 2019. Yet, it doesn't look like the world doesn't know what it needs to do. Or as the Global Preparedness Monitoring Board puts it in their 2022 report, hundreds of expert recommendations have been made over the last decades. New structures have been created, but the level of ambition and action has failed to match the global needs. We know what to do, we just cannot seem to do it. Do we really know what to do? And if so, why don't we just do anything to prepare the world for future pandemics? I'm more than happy to discuss these and many more questions with a fantastic panel of renowned experts that you've already been introduced to. So a warm welcome also from my side. Very much looking forward to discussing with you, even virtually. And I must say it's a first to discuss, to moderate a hybrid panel virtually. So thank you for your understanding. It is an honor that you have accepted our invitation on this panel, and I welcome you on behalf of Global Solutions. And I, of course, welcome you all in Berlin and in the digital world. I invite you to ask your questions via the chat box, because we'll aim to answer as many of them as possible towards the end of our session. But without further ado, just let me start with a question to all panelists. Dear panelists, let's start with an assessment of the status quo. Does the world already know what to do? And if so, why don't we act? Anja, would you like to start?
Thank you very much. Well, that's a very good question, and I think that's probably what a lot of people are thinking about as we're looking ahead. Obviously, the COVID crisis is still very much going on. The data is shifting all the time, and our strategies need to adapt in terms of what we're doing as we learn new things. We continue to focus and should continue to focus very much on the most vulnerable and on health equity, because I think that is the most important, directive that we should be following. But at the same time, I think it is also time to start looking ahead a little bit more long term and think about some of the other high burden diseases, HIV, TB, malaria, which are obviously very important ones to address that have been falling behind a little bit during the last 2 years. Also, there are countless economic and societal challenges with regards that came with COVID that I think we need to address. So there are a number of very important steps I think that one can take. Speaking from the foundation perspective, we've spent a total of about 2 billion on the COVID response, and that was a mix of upstream investments, catalytic investments where we're trying to drive new instruments and tools, but also some health infrastructure investments. And what is always important for us is really to think about a functioning R&D ecosystem where we are ready to invest in platforms and are able to then scale up as innovation and solutions are being found and to turn them into products. Because we are at the Global Solutions Summit and of course thinking about the G7 and the G20 as platforms that are important leverages and drivers where some of these learnings can be taken on board and can be discussed amongst leaders. I think we should think about a couple of lessons learned that hopefully to your question, do we know what to do? It is interesting to see that as we are focusing on, what is the next virus going to look like? What is the next disease going to look like that may turn into a pandemic? And what do we need to strengthen health systems and think more institutionally? There is actually convergence pretty much on the things we need to do. And I think they are not that unclear to people. It is just that they do need to be implemented. I mean, for one, we've seen how innovation can, of course, drive things forward. We've been able to develop a vaccine faster than ever before. The UK presidency set a goal of 100 days. With the mRNA technology, I think there is still room to go even better and even further in the future. I think we've all seen very clearly how important surveillance is. We do need global surveillance systems that can detect, respond, and also alert globally in a very integrated and practical fashion. Something that is not so much talked about, but that we feel could be really important is a global network of responders, experts and specialists that can be deployed and also are advising and are able to advise national governments, coordinated by the WHO. I think that would be a good idea to have in place. Of course, further investments in R&D, I think, are something that we all seen are incredibly important. We do need a global coordination mechanisms. We need, for especially the G7 countries, to come together and be able to actually decide on funding and on lessons learned and principles of equity. And I think if we bear in mind some of these general lessons, that is something that will hopefully put us in a better place. And as we look across and sort of more long-term to the lessons that we may have learned from this pandemic.
Thank you, Anja. Michael, speaking of equity.
Wonderful, thanks. Apologies, I was cut off from audio, so I didn't hear all of the previous presenters. So I think there are many important lessons to be taken from the COVID pandemic for preparing for and preempting future public health and economic crises. I'm going to focus on the health side, since I think that's very key to the economic side. It was estimated early in the pandemic that the world was losing roughly $500 billion every month that the pandemic was going on. And we all know the enormous human cost of the pandemic, accelerating the development of vaccines or drugs or otherwise bringing this under control would save hundreds of thousands of lives, even accelerating by a month. Similarly, it would save huge amount financially. So if we view this just as from a pure benefit cost perspective, and I think we should view it much more broadly than that, this is just a fantastic investment. Anything that has even a small chance of reducing the likelihood of a pandemic or of accelerating the end of it. And I think that has many dimensions. I heard the very end of the last speaker's presentation, and that could include a wide variety of things. Surveillance was mentioned. You could think about reducing the chance of this happening through addressing antibiotic resistance, through addressing human-animal interaction. But also, once a pandemic is on us, accelerating the availability of, I think there are steps we can do now to do this, to accelerate the availability of vaccines or drugs or diagnostics, or of finding better non-pharmaceutical interventions that are more effective from a health perspective, but less costly from an economic and social perspective. It's really a tragedy that we shut down schools for so long in so many places with tremendous human cost, when it's not even clear that that was the most effective thing we could have done against the pandemic. I think so. What in particular could we do now? Well, and to set up to prepare ourselves. Well, I think I'm going to focus mainly on vaccines, but I think across the board, we could put. I'm focusing on vaccines because that's where my work has been, but I do want to say that all of these areas are important. Setting in place both the research infrastructure and the production infrastructure, so that we can rapidly have. We know what vaccines might work, what drugs might work, what diagnostics might work, what non-pharmaceutical interventions would work, and then we could rapidly put them in place. In the case of vaccines, it's very important to have the capacity in place and to put the standby capacity in place now. We obviously don't know exactly what type of the challenge will be in the future, but there's a lot of things we can do because there's some common inputs. And having that in place now will both allow a faster response and it would allow a much more equitable response.
Thank you so much.
I'm happy to elaborate later.
Yeah. Vera, is there anything to add from your point of view?
No, thank you. First of all, thanks to the Global Summit for inviting me. I think, listen, I was privileged to be part of this global pandemic preparedness panel or working group that was led by Tharman Ngozi and Larry Summers, really to think about, what do we need to do and what are some recommendations going forward. And one of the first things I think we all agreed to even before we met was that we must agree that pandemics are a global public good, and we must find a global way of trying to sort of solve for them. And what we saw during this pandemic was clearly much more nationalism. So to your question of, do we know what to do? Yes. Are we doing it? Probably not. And then the question becomes why? And I think it's because the way, the institutions today are set up, they're not really set up to respond to sort of global commons in a way that works, because we still have sort of bilateral funding, multilateral funding, private sector funding, and no real institution that can bring all of those together in a way that is, one, fast enough. I think that one of the things that we missed in this crisis was sort of the speed of, first of all, even just understanding what we had to deal with, and then secondly, how to respond to it in a way that was more effective. Yes, of course, the West, once we had vaccines, and as you said, the fastest vaccine development process that we have seen, and we must continue to celebrate that, because it means that we knew what to do. We knew how to go and find the solution. Did we know how to use the solution appropriately? And the answer, again, was, I think one of the things we discussed at this sort of conversations on the pandemic preparedness and what more to do, there was a tension between, do we need to create new institutions and do we not need to? We on the African continent, the Economic Commission for Africa, working under the leadership of the African Union Commission with Strive Masiwiya, who was leading this, because there was this sense of nationalism very quickly, we came together and said, how does Africa come together as a continent to solve the problem for itself? And so we reduced the global commons from a sort of world problem to a continental problem. And we did a good job, because what we then did was we were able to raise resources through innovative financing, working with Afri-Exim Bank, to put some money for some resources forward. and be able to sit at the table and say, we can also buy vaccines. And the only vaccines, the first vaccines that landed on the African continent were vaccines that were bought by Africans. And essentially, I think that until we are able to create systems that allow for Africans to also sit at the table at the same time, then, we are not responding to the problem well. Yes, we created COVAX, but COVAX put Africa on the last sort of, we will get to you after we've gotten to everybody else. And those kinds of global governance systems, once you have a global financial system that is not really ready to respond to a crisis immediately, we had to wait almost a year to get the SDRs out with a lot of asking. And when they finally came, only 5% came to the continent. But then we also had the institutions that were putting Africa at the end of the line. I think we need to revise these things, and we maybe need to create a few more so that we can create some contestability, some competition, which will maybe force the ones that exist to change a little bit in the way they function. Now, I think where we have been able to do a good job is in terms of pulling together scientific research. And yes, maybe there has been some conversations around when South Africa and Botswana first discovered the Omicron virus, the global reaction was probably not the right one. But I think what ended up happening was we had a global scientific committee that came together, community that came together and said, how can we analyze this new variant? What is the reaction? Do we need to ask for a booster? And I think that is an important part of the new fabric that we have to develop going forward, is to create this intellectual tissue that is, again, global, that allows us very quickly to respond to these kinds of crises. And then finally, of course, is where the private sector fits. I think we didn't really use the private sector skill, capacity, and responsiveness as fast as we could. On the continent, what we tried to do was put together what we call the African Medical Supplies Platform, which is a trading platform, which allowed for transparency, allowed for the private sector to be able to participate in not just the production and the availability of vaccines, but also the whole logistics chain around how we distributed the vaccines, where were the main sort of retail stops and the wholesale stops. Private sector knows how to do these things much better. If you come to the continent, Coca-Cola or any one of this MTN as a telecoms company, they know every client, they know where they are. They can reach them much faster than governments can. And so I think, when we have a global pandemic like this one, part of the global commons means bringing the private sector in, not just for their resources, but also for their expertise. And I think we need to do that better next time.
Thank you, Vera. Lars Hendrik and Dirk, I would like to hand over to you from a political point of view. And I would love to start with Lars Hendrik.
Yeah, so let me just, I think very much in line with the two previous speakers said, I think that the response was actually quite promising of the world. We started this ACTA-A COVAX in the G20 in early 2020. And if you look at other multilateral issues, that wasn't a bad start, compared to some of the other ones. The problem was that it sort of fell apart, and when things became worse politically, national responses emerged. We had all these task forces in different countries. We had one in Germany, we have one in the EU. I'm talking about vaccine fairness and vaccine distribution. It was very difficult to sort of keep the justice and the security of supply for Africa in particular going. We then started a vaccine manufacturing working group at COVAX. There was a task force and there was a political working group above that, which I was chairing, or parallel to that, which I was chairing together with South Africa, looking at the impediments to providing vaccines to the developing world globally. And we had some suggestions which then were introduced into the G20, very much along the lines you were talking about, Vera, specifically not just on research, which I think was relatively okay, not being a big expert in this field, but on the production. There are different models of actually moving towards localized production. And there was a hub in South Africa, which we're working on. BioNTech, as the Chancellor was saying yesterday, is starting to goes towards containers, sort of shipping containers. That we were pushing that very hard already in the fall of last year. But that was mostly fill and finish in Africa. So it's not really production in Africa, and it's not equity in Africa. So I think in the end, to solve some of these incentive problems for the next crisis, are we going to fall back and again look at our own citizens first, which you might argue is a democratic principle, we need to think now, how can we create the right incentives so that next time this won't happen? And I think localized production, including equity, is a very important one. So I think that's one point which was very important for me, but I don't think it was all that bad, but it was clearly not sufficient. And I think we need to better. The other point I think Vera made is the governance issue. So while we were working on this at ACTA COVAX, in terms of what do we need to do, the waiver discussion was in the middle of that as well. There was numerous other working groups. There was a high-level working group with the IMF, the World Bank. There was, I think, the group you were part of. The private sector was also doing their thing, but it wasn't fully integrated. At the G20, we had a discussion about financing. There was a discussion about a new fund, and there was a big discussion. I don't think it's resolved yet. You may know more about the current situation, whether it should be at the IMF or where it should be located. So I think the governance is clearly in need of improving. And I think lots of duplications have been there, and integrating the private sector, I think for me is a key message. Third point, and then I'll close, is that this is not in terms of preparedness. My thoughts or my suggestions sort of more thinking about the commitments the developing world has made. So we made the 70% goal, the financial commitments in ACTA COVAX. The Chancellor yesterday said that Germany was going to increase again its commitment to COVAX. I think Germany is a major contributor, but there are many countries around the world who are not. So I think having these commitments actually being resolved, I think is another important step forward and gives credibility. Very, very last point, it's not just on health, but it's also on climate. And I'm not sure how it is in terms of the latest war in the Ukraine. There is a split in the G20 along those issues. And it has a lot to do with credibility and double standards of the West and the rich countries towards the developing world. The G7 is there. Germany is the presidency this year. I think we need to be very careful that we actually, continue talking about these issues in the G20 and don't go down a route into, let's say, the rich and the poor countries on these very important multilateral issues.
Thank you. With that, handing over to you, Dirk.
Yes, maybe in this round I'm the optimist. Although, before we start talking about preparedness, we all have to state that we are still in mid of the pandemic. Me, member of the government, still acting according to the question that we are still in it. Every 4 months we have a new virus variation, and we still know how the pandemic will end. So we are talking very much and acting. Your question was whether we act. Yes, we do act. In all governments around the world, we act about the question of the last mile, for instance. We have the situation that we have enough vaccines, but we have to get them into the arms. So we have logistic problems, we have transport questions, we have questions of needles and things like that. So we are still acting very much in mid of the pandemic. Secondly, we see that we need very flexible financing instruments to be able to respond as soon as possible after a new variation. So we have to establish that, and what I do at the moment is to collect money from the G7 countries. So every day I have phone calls to my colleagues to collect money. And I'm very glad that the German government decided to deliver for this year, for Act A, 1.1 billion euros for the next phase of that. So we act very much, and if we look at the pandemic, I see maybe just 3 points that show that we really know what to do. You just mentioned Act A. Act A is one of the, for me, one of the most fascinating agile platforms in the multilateral organizations we see. And beside all the problems we had, we were able to deal with a lot of problems and learn during the pandemic by this Act A agile system. Secondly, we were able in the world to develop a new vaccine, the mRNA vaccines, that will help us for many other diseases for the next future. So it is a breakthrough in the vaccine technology that was discovered. And thirdly, we are very seriously talking about local vaccine production on the African continent. We have several projects on the way. We have the one of the mRNA production in South Africa. We have the BioNTech experiment. We are quite close in the talks with the governments, and we are on the way to establish this sort of local production. So, to sum up, what I see is, of course we know what to do, because COVID-19 was a learning machine for a global health crisis, and we started to react as a global community. And this will help us very much to get prepared for the next steps, for the next pandemic, even for the next virus variations. And therefore, I think the pandemic was a historical step in the learning of how to manage such a severe crisis.
Thanks, Dirk. Michael, just speaking, and Dirk just touched upon it. I mean, we're in the middle of this pandemic still, basically everywhere. But how can we prepare to ensure a much greater resilience of global health and economic systems in the future?
You know, I think I think we did make a lot of progress, but I think there are a lot of things that we left that we did not take, where we could have acted and we didn't act, and I think we can try to remedy that in the future. So let's start with this issue of production capacity that I mentioned earlier. You know, one of the issues was there were multilateral efforts, and maybe they're, in fact, if we compare it to climate change, you know, maybe they're better. But there's also a real problem of failures in the multilateral system and failures of international solidarity, as we've heard. Now, I think, as was pointed out, to some extent, that's something that we can anticipate. Governments are accountable to their citizens. In a crisis, they're going to prioritize. So and that led to export bans, that exacerbated shortages because there were shortages of inputs as well. How can we deal with that? Well, one thing that we can do is by putting the adequate supplies in advance, to the extent that we can do that, and I think there's a lot that can be done. The basic bioreactors, the lipids, a bunch of the inputs can be put together, as well as production lines that can then be more rapidly repurposed. That isn't just hoping that actors will act better in the future, that countries will perform better, and that just calling on multilateralism. That's actually changing the incentives, taking steps to change their future incentives. And I think that sounds like a theory, but if we take the example of personal protective equipment, when there was a global shortage of this, countries acted in a very nationalistic way. Once that shortage was addressed, then these export bans, on hoarding of personal protective equipment, that then ceased. I think if we can get adequate vaccine capacity in place, then that's going to reduce some of these incentives for bad behavior in the future. Once a pandemic is underway, there are other steps that we can take. So, for example, one of the reasons why the shortage lasted so long, and we're now perhaps out of that period of the acute shortage, but one of the reasons was we didn't know appropriate dosing. Companies were working to get something that would work as soon as possible. They couldn't afford the normal process of optimizing the dosing, so they went with relatively large doses. It's quite possible that smaller doses could have worked. If you look at, say, the experience of yellow fever, they moved to 1/5 doses, and these worked quite well. There are other examples like that as well. That could make 5 times as many doses available, could allow the world to be vaccinated, much, much more quickly. The basic scientific research, once the private incentives to conduct that research aren't strong, But if there's public funding to conduct that type of research, which I think there needs to be, and that's really a global public good, then we could maybe stretch the doses that we have more, if it turns out to be appropriate. Obviously, if you don't get the effectiveness, that's a different matter. Similarly, we didn't do the basic research that was needed for to understand which non-pharmaceutical interventions were effective. I mentioned schooling, where shutting down schools now looks like it probably wasn't effective, but we still don't have solid evidence on that. There are basic steps like testing filters. That could have been tested quite cheaply. There's not a strong private incentive to do that because there are many filter manufacturers. That's the sort of thing that could have been publicly supported. So I think all of these things would promote both faster end to the epidemic, save lives, save money, but I think they would also promote equity, because if we can get greater capacity, that shortens the queue, so that that shortening the queue benefits the countries at the front of the queue a little bit. It benefits the countries, if we cut the queue in half, that cuts whatever countries at the end of the queue. And I hope that we'll have a more equitable system in the future, but it cuts things at the end of the queue much more dramatically. If you cut it in half, if instead of waiting 2 years at the end of the queue, you're waiting a year. So I think those are examples of steps that we can take now.
Thank you, Michael. Thank you, Michael and Vera. I've seen you nodding multiple times, and please, for the others, please feel free to chime in and build on what Vera just says. But how could we, from your point of view, reignite multilateralism in response to pandemics and help developing countries to recover faster?
No, thank you. I was nodding because, yes, I agree with all of that. And I think once one is in a pandemic, again, as we discussed in the council, but also as we saw, is the first thing we need is to act quickly and to act at scale. And to act at scale, we need to act as a global community. And we spent a lot of time at the beginning of the pandemic, discussing whether we should be helping low-income countries or vulnerable countries, or I think all of that was such a because we know that a lot of those who were at risk the most, particularly with this kind of pandemic that was really touching, first of all, countries, emerging market economies and low-income countries that are tourism dependent. They don't necessarily fit into one of our nice, neat categories of middle-income or low-income countries. And so rather than looking at, using sort of old definitions to address a pandemic, which was sort of cross-cutting into our different societies, we should have just agreed, let's go to those who are hit the most. We had definitions of how that works. I think the fact that I mentioned it before, we took so long to inject liquidity into the middle income and low income economies, I think made the problem worse, because we spent so much time again discussing, was it liquidity, was it debt, as opposed to worrying about, a pandemic that was taking us 25 years behind. At least on the continent, we experienced the worst recession in 25 years, just because we spent time discussing what it was, when we all knew what it was. And I think we lost speed, we lost scale in some of those discussions. And then I think the other thing that we need to do, and Germany has been a leader on this, is really, again, I want to insist on this, seeing how we can bring in the private sector. What is it? So when I take, in some of the conversations, we African finance ministers got together and talked about, can we have a debt standstill for a while? But then we decided, well, we'll do a debt standstill, but let's throw in something else in it. Let's have comparable treatment. Let's bring in this and this. And we put politics into solving a pandemic. And so nobody took the debt standstill or the DSSI for quite a while. And the situation got even worse. And then we thought, okay, well, maybe we can discuss, how we deal with the debt problem itself. So we created the G20 Common Framework. But then again, we made it, comparable treatment. It wasn't clear. There is no clear sort of cutoff of when you decide that the country should take, come in for a debt restructuring. And with the new crisis that has hit, we find ourselves in an even worse situation. So I think, the other lesson that we're learning from this is really not to conflate private, a lot of emerging market economies are now accessing financing from the markets. And yes, they're also accessing financing from the multilateral community. Maybe we need to begin to prepare for this new and emerging financial architecture for when a crisis happens, how do we deal with it? And not to use the crisis to try to solve the problem that we forgot to deal with before, because it just makes it even more difficult. And I think that is something that is going to plague us for a little while longer, because we still don't know. And we are urging, and maybe on the leadership of the G7, we can see how we really resolve this issue of debt and solvency. And for us to recover, something that we are not talking about is investment. Not just debt, but we do need investment to be able to actually come out of the crisis in a way that is sustainable. And I think that's another thing. Can we have an automatic mechanism that says if a pandemic is systemic, there is an immediate release of SDRs? And maybe we should relook at, the distribution of SDRs in a way that works better for those that are the most vulnerable for that particular pandemic. I think these are some of the things that we could look at going forward, which will make the heat that we saw at this pandemic sort of less when we have the next one.
Thank you, Vera. Dirk, Anja, and Lars Henrik, are there any points to add to this from your point of view?
Just to make it very short, 5 very short points. First of all, we have to respect the planetary boundaries, coming back to the causes of pandemics as we talk about zoonosis. Secondly, we need a pandemic treaty. We are working on that worldwide because we need a good governance for the future pandemic. Thirdly, we have to have very flexible finance structures and facilities that are complementary to each other. Fourth, we need local production, especially where we don't have that. And fifth, we need resilient health systems to be established everywhere, so that health systems come on the agenda in all countries is a global topic.
Thank you.
Yeah, I think I agree with all of that, and I think we've said this already sometimes before, but I think the point Michael made about what can we do now to create the right incentives for the next one, I think those are very important. We had a long discussion on the localized production, and I think it's a very different story if you're working under a shortage situation or where you don't have a shortage situation. I think under the shortage situation, for sure, you need to go more towards localized production, and I don't think we're quite there yet. But even if you're in an abundant situation, most of the companies who are producing in Europe, also in Germany, I think the capacity of the Marburg factory, this is one factory of BioNTech, is 1 billion doses. This is a little bit outdated, so I'm not sure exactly what doses, but it's huge. And they say, we're producing so much, we will provide the rest of the world because there's enough of that. And I think the rest of the world has become very skeptical because of these trade restrictions, other things which we put in place. So I think we would need these localized productions, whether you have shortages or not, and you're bound to have shortages, whenever the next pandemic comes anyways. But I think other incentives we need to think about. The governance part, I think, is a very good point about the financing of it. This is a big discussion we had at the G20, where with the IMF and the World Bank and the leaders, high-level leaders group is thinking about it, WHO, WTO. And of course, they're all have their competences, and some of them are increasingly overlapping in these crises, in particular between the IMF and the World Bank. So I think we need to rethink that generally, and there's a UN group now, which Secretary General Guterres, I think, just recently announced, Advisory Council, I think former Swedish Prime Minister Löfven and Madam Sirleaf is heading that one, thinking about governance issues. It would be good if the G7 could support that initiative, because I think that's an important step forward.
Yeah, I mean, reacting to a couple of points, I do agree also with what Michael and Lars said with regards to production allocation. I do think in a crisis situation, it'll be have high hopes and maybe unrealistic hopes that allocation, even if from a moral perspective, the world agrees on certain equity principles, that it'll be possible that you actually stick to it. The stronger the crisis is, there will always be pressure on governments. And so if we can make sure that we have you say abundance, that we have a production capacity that is larger, then of course we are minimizing that allocation discussion and problem to an extent. I do think that localized production is a sort of a long-term process that one needs to tackle from different areas, but I think we've seen already in this pandemic a lot of second source deals and also discussions around IP that have been very, very successful. And I think that's where we need to build on and make sure that we're incentivizing the private sector in a way that exactly what we're describing happens, that if there is an innovation, if there is a tool and an instrument found for rich countries, that low and middle incomes have access to this, have access to these same tools at the same time. And I think this is where the responsibility of G7 countries come in to make sure they can fund with grant funding, but also with ODA grant funding and potentially setting incentives for the private sector to enable that these tools and instruments have equitable access at the same time. And that's, I think, what we should really concentrate on for the next challenges to come.
Thank you, Anja. And we're coming towards the end of our session, so perhaps just some short statements from all of you. How do we really make sure that the pandemic preparedness is not dropping off the global agenda, given the challenges that we currently face in Ukraine and elsewhere? And Lars Renrik, you have touched upon this in your opening statement, so perhaps you want to start with that one. Please, short statements. Thank you.
I'll be very short. I think I said what I wanted to say is I think that one way is to think about this UN group. Maybe this is a good way forward if there could be support from G7 and G20 to those recommendations. And I think it's obvious what they need to look at. We've touched on many of these things. So it'd be good if there'd be support from member states to do that. The final thought I had is when I looked at this issue of production, sorry to come back to that, we had all these national incentives to produce in our home countries. And I'm not excluding anyone from that, and it is understandable. I think that it's, again, good that we think about localized production, for example, in Africa. But the problem I had very often, where does sort of a legitimate health concern end, and where does active industrial policy start? Because there's that element of that as well, that you want to have the industry in your country, creates jobs and other things. That should not be the main issue right now. It should be a health concern issue. I'm not saying anybody's thinking that way, but I think under everything else, I think that also plays an important role. I think that also plays a role, by the way, in developing countries, because they also like to develop that industry in their country, which is legitimate. But I think we should not let that get that in the way of getting the health concerns solved correctly.
Thank you, Anja.
Yeah, I think as I've said before as well, we see a convergence into we really need to strengthen the health systems. We need to, in addition to that, complement with some very pandemic-specific intervention. We've talked about this, R&D, innovation, but also surveillance, monitoring, potentially a pool of experts that can be fast responders. But really what we need to strengthen everywhere are, primary health care, but also health systems, plus build very strongly on the multilateral priority instruments that we have seen were also incredibly important in this. This is Gavi, this is the Global Fund, this is CEPI. These are the instruments that we saw were effective. Of course, anything can be improved, and so can be COVAX and Act A, but I think we've still seen a tremendous effort. So I would say health system strengthening, enough investments in R&D going forward and get product ready and strengthen the existing multilateral instruments that have performed well.
Thank you. Dirk?
Yes, very, very short, just to add. While we are still facing the current COVID crisis, I see many steps in the global system to prepare a resilient global health system. Therefore, because of the high cost, because we all realize that we are only safe if everybody is safe, I think there is the momentum for a preparedness push in the world, and it's the task and the duty of all the plurilateral organizations to push this forward, and I'm optimistic that we use this momentum.
Thank you. Michael and Vera, really short statements, please.
Yes, I think that we are seeing, with the COVID crisis, with climate, that these are problems which affect us all and which we have to tackle together. Now, I think it's important countries will take their national measures, and that's appropriate, but I think it's important to realize that for every country, it's in their self-interest to have access to products and services from around the world. And most candidate vaccines fail. We were very lucky in the case of COVID that many worked. But it's not enough to rely on your own technology. Even very large countries, the US got lucky, and mRNA vaccines. Yes.
Michael, I'm sorry.
I'll finish up.
Thank you.
China, I'll just finish the sentence. China has relied on their own vaccines. That's very dangerous. It could have been us. We all need to have an open trading system and financing so we can purchase vaccines wherever they're made.
Thank you very much, Michael. I think we learned that the world has a lot of responses, but it isn't that easy. And I want to really thank you to all our panelists for your contributions and for your insights.
One thing before you close, if I may.
Of course, Vera.
Sorry,
you're free.
Sorry, you didn't come to me. No. I think on the manufacturing, because many of us have talked about it, we have to be really careful that we don't, as you said, we don't leave white elephants. That many vaccine manufacturers we need on the continent, but we need syringes, we need gauzes, and so I think there is a whole diversification of production that needs to happen. The problem is not only Africa wanting manufacturing plants, the problem is all those donors also just trying to build manufacturing plants, and I think we are maybe overstepping what the private sector should do. So that's one thing I think we need to really look at and just make sure. The second and last thing is what Africa needs today, and I think many of the developing world, is vaccinations. How can we ensure, and I fully agree with Anya, health systems resilience, and then vaccinations. Those are the two things I think we need to continue to build on in a way that makes sure that we succeed. Thank you.
Thank you, Vera. Thank you to all. Thank you to you all. And I just finished with the words, stay safe and stay healthy and have a good rest of the day. Thank you. Bye.